Hey guys, Dr. Novelli here at the Novelli Wellness Center in Orchard Park, where we relieve neck pain, back pain, sciatica, headaches, even neuropathy and knee pain. Today we're talking all about how many visits of spinal decompression does somebody need or should somebody do. Most people in our office, they'll do about 3 days a week if they have back pain with sciatica. If they have neck pain and maybe they have numbness down the arm or into the fingertips, maybe they're a little bit weak in their grip strength. Again, they'll do about 3 days a week. Some people are in just tremendous amounts of pain, and they'll actually come 5 days a week because they feel better when they do. So if it's helpful, right, and you can come every day and it gets you sleeping better and moving better, and now you're able to take care of your children and drive, you might actually go 5 days a week if things were really, really bad. Just like you might, I don't know, brush your teeth 5 days a week, right? Most of us would say we probably brush our teeth at least 5 days a week. You want to do spinal decompression about 5 days a week if you're in really rough shape. However, if you're just, it's painful, but you can bear with it, then you would come 3 days a week. And at each visit, we're using the spinal decompression technology to go ahead and open up the spine. If you have a nerve that's pinched right here, this yellow nerve, that nerve can get pinched like this. What we do is we open up the spine by using decompression. It takes the bones right here and it pulls it off the nerve right there. Or if you had a herniated disc, which is very common, a disc herniation, it comes out like that and it hits the nerve. When I do decompression on your spine, I actually slowly and gently stretch you in a way that pulls that disc back inside the spine and opens the pressure, relieves the pressure deep inside the spine, right where you need it the most, right along the sciatic nerve. Now guys, there's 4 sciatic nerves on your right leg and 4 sciatic nerves on your left leg. There's a total of 8 nerves altogether that run from your spine, deep inside here, all the way down. So you see 1, 2, 3, 4, 5, 6, 7. There's tons of nerves, right, in your back, but only 4 of them are actually the sciatic nerves. So when you have sciatica, it might go to your foot, it might go to your hamstring, it might go to your thigh, it might go to your calf. Those are all sciatic nerves. So depending upon which nerve it is, we'll target those areas specifically with the spinal decompression table. So for example, the brand new 2023 spinal decompression tables kind of look like this. You can see how she's standing up, she's got a harness on. Well, eventually she'll lay all the way down flat so she's on her back, and we'll slowly stretch her. What we do is we actually have this computer right there, and we'll tell the computer which bones it is, which nerve it is, how much you weigh, how old you are, all this information about you, and we target the problem areas specifically based on all that information. The computer runs a computer algorithm on the human body to actually analyze where the problems are, and the tables have sensors. The decompression tables have sensors built right into them. So when you're coming about 3 days a week, 4 days a week, 5 days a week, whatever it is that you need, I'll sit with you and I'll determine how many visits a week should you have, why should you have them, and then I'll show you the research studies that prove that this works scientifically, because we have the studies out of Journal of Medicine, right? 9 out of 10 people satisfied with their improvement. In 8 weeks, this research study showed people who went 3 days a week, like we're talking about, had pain levels go from 6 out of 10 down to a 0, almost a 0 out of 10 in 8 weeks. Here's another study. This is the Dr. Leslie study out of the Mayo Clinic. This was a 6-week study. People were coming 3 days a week, and that was a 6-week study, 20 visits over 6 weeks. The average improvement was from a 6.5 level of pain down to a 0.8, so less than 1 in 6 weeks. So most people go 3 days a week for that 6 to 8 week time period to get the relief that they're looking for. So guys, thanks for tuning in, and go ahead and click below to claim your free spinal decompression treatment to relieve you of back pain or sciatica pain or neck pain or maybe even headaches, and we'll get you back in tip-top shape. I'm Dr. Novelli out in Orchard Park at the Novelli Wellness Center, and I look forward to meeting you. Thanks so much. Have a good day. Bye-bye.